Shall we start, sir?
Yes, we can start.
Good afternoon, everyone. I'm Dr. Kirti Suta from Dr. Makkar's Diabetes and Obesity Center. Today, we'll be talking about type 1 diabetes. Type 1 diabetes, once known as juvenile diabetes or insulin dependent diabetes, is a chronic condition in which pancreas produce little or no insulin. Different factors contribute to type 1 diabetes. Although type 1 diabetes appears in childhood or adolescence, but it can also develop in adults. And it's a fact that type 1 diabetes has no cure, but treatment focuses on managing blood glucose levels by insulin, diet, and lifestyle changes. And it is also a fact that type 1 individuals can lead a near normal life by balancing medication, lifestyle changes, but with discipline. There are a lot of examples of type 1 individuals who are doing very well and, in fact, are an example to the society. Definitely, yes, type 1 diabetes needs a lot of care and empathy. And there are a lot of myths, lot of questions and confusions in the mind of patients and the caregivers regarding the disease and the treatment. And so today we have Dr. Makkar with us to give answers to these FAQs. Welcome, sir.
Thank you, Dr. Kirti. Good afternoon, everyone.
So my first question to you is, what is the cause of type 1 diabetes?
See, we all know that diabetes is caused by absolute or relative deficiency of a hormone called insulin, which plays a critical role in control of glucose levels in blood. So that hormone action, insulin action, is vital in maintaining the normal glucose levels in body. Now, there are two ways, why the action of insulin becomes insufficient or decreased. One is there is decreased production of insulin, which is because of the damage to the cells, so-called beta cells in pancreas, which produce insulin. And other is that though beta cells are producing insulin, but there is resistance to action of insulin in body. Various tissues are resistant to action of insulin. They don't respond normally to the insulin action. So this resistance to insulin action or insulin resistance is one of the key features in type 2 diabetes. Type 1 diabetes is caused by deficiency of insulin, and this deficiency is almost absolute. So which results from some kind of viral infection leading to autoimmunity in the body. And there is autoimmune mediated destruction of all beta cells that are there in the pancreas, which leads to near total deficiency of insulin in the body. And since there is no insulin, there is no way that we can bring down the glucose to normal levels. So it's absolute insulin deficiency resulting from destruction of beta cells leading to very high sugar levels, and this is classical of type 1 diabetes. This is the very general understanding that you can explain type 1 diabetes by.
Right, sir. So my next query to you is there any risk factor because of the paternal diabetes or family history of diabetes for type 1 patient, for type 1 individuals?
Actually, family history has more relevance in causation of type 2 diabetes. Because if you have somebody who has diabetes in the family, the chances of getting type 2 diabetes are higher. If one parent is diabetic, 50% chances. Once I say one parent diabetes, matlab parent is type 2 diabetes. So if somebody has type 2 diabetes in family, there is markedly increased risk of getting type 2 diabetes in children. But in type 1, yes, there is some predisposition, some increase in predisposition for developing type 1, but largely there is no significant risk increased for developing type 1 diabetes because parent has diabetes. So there is small amount of increase in risk, but it is not as significant as it is seen in type 2 diabetes patients.
Okay. So my next question to you is, what are the signs and symptoms with which an individual presents
So the classic symptoms of diabetes are increased thirst, increased hunger, increased urination, and weight loss. These are the classic symptoms of hyperglycemia or increased glucose levels. So this is called polyuria. Poly means increase, urea means urination, polydipsia means increased thirst, polyphagia means increased hunger, increased eating, and there is weight loss. Now, important thing to understand is that most of the type 2 diabetes patients do not present with these symptoms because there is a gradual decline in the insulin action over a period of time, and there is a gradual increase in the glucose levels. So body is very much adjusted to those gradual increasing levels, and the symptoms are usually absent or they are less marked. In type 1, since it results from almost sudden or a very short over a very short period of time, there is a near total destruction of beta cells leading to severely increased glucose levels. The symptoms are very marked in type 1 diabetes. Type 1 diabetes usually happens in children, young adolescents, as you mentioned in your introductory remarks, but it can happen in adults also, which is called LADA, or late onset autoimmune diabetes of adults, which is a variant of type 1, you can say. So whenever there is type 1, the symptoms are very marked. And in fact, good number of time, the children present with diabetic ketoacidosis, which can be a life-threatening complication, and they need hospitalization. They are diagnosed once they get into diabetic ketoacidosis or severe hyperglycemia and resulting some infection or some emergency situation. That's how they get diagnosed. So the symptoms are very marked in type 1 diabetes. And these are the classic symptoms. But children can present with diabetic ketoacidosis, septicemia, chest infections, multiple things, acute infections, acute emergency situations. Children can present with very severe diabetes.
So how is it diagnosed? The test
So
which leads to
test
the diagnosis.
all diabetes needs to be diagnosed on the basis of glucose levels, and the fasting glucose more than 100 or 126 is the diagnostic of diabetes, and more than 200 in the postprandial or post-meal state is diagnostic. Now, important thing is type 1 usually will present in the range of 300 to 500. They will not present at 130 or 150 levels. So they have severe hyperglycemia, marked symptoms. Usually, they may, more often than not, they will be the ones who will get complications as compared to type 2. So these are the common things that we have to keep in mind. And diagnosis is based on increase in blood sugar levels, and if you can check on the A1C, you can also do the A1C level. But to classify this is type 1 from type 2, you have some specific tests like C-peptide and insulin antibodies or GAD antibodies, which need to be performed, but they may not be necessary when the child or a young adolescent is presenting for the first time with diabetes, with classical symptoms of polyuria, polydipsia, polyphagia, weight loss, and or with or without some severe infection or some ketoacidosis. So all these classic symptoms in child are indicative of increased glucose level. One must check sugar levels, and if it is high, one should presume type 1 unless proved otherwise. Even if you don't have the facility to do a C-peptide or GAD antibody, you are in a remote area, you should treat these people with insulin. That's the only treatment that works in children or type 1. And, you can get those tests at a later date to define whether it is type 1 or type 2.
So once a diagnosis of diabetes is made in an individual, coming to the management part, it's the medication, diet, exercise. Now I'll start one by one. Let's talk about how important is diet in the management of type 1.
Diet is, always crucial because whatever you eat, will give rise to glucose levels. Now, this increase in glucose is to be controlled by a certain amount of insulin. So unless you have a balance or you have a, kind of a ratio which is finalized between the amount of food intake and the amount of insulin required, it is virtually impossible to control glucose levels. And if the person is, suppose a child is eating variably, one day child is eating 1 chapati, second day it's 3 chapatis. Now insulin requirement will change with the amount of food intake. Will also change with the amount of time of food intake. Will also have different impact when child is eating frequent meals in one part of day and less frequent meals in another part of day. So diet, not only the modifications of diet to make sure that we have preferably less glycemic load or glucose load from food coming and lower glucose glycemic index, which does not cause sharp increase in glucose level. There has to be a more, portion size of the meals have to be more or less fixed to have a good glycemic control. Eating on times is very important to have good glycemic control. Skipping meals should not be done, because once somebody has taken, insulin in the morning, and there is some amount of insulin which is basal insulin, also long acting insulin, and person misses meal, person will end up with low sugar level or hypoglycemia. And hypoglycemia we have discussed in detail during these presentations. So it is very important to have a balanced, healthy diabetic diet. One should consult a nutritionist or dietitian to have, professional advice and a professionally designed diet plan for diabetes patients. But for children, it becomes a challenge because children have to, move with their peer groups. They have to go for birthdays. They have to go for, their friends' parties and so on. So you have to understand that those will be the times when they will get into fluctuations. And, you can't stop, you should not stop them from going to school, children to school or school party or a birthday party or a outing, how can you stop? They have to learn those things also. But you have to train children how to behave during those periods. Importantly, if the children are small, school teacher, the class teacher must know that this child is diabetic. And these are the precautions that we have to take when we have a diabetic child in the class. Parents must also communicate to school principal to make sure that child gets, that little extra attention or just a watchful eye is there, that if something something is wrong with this boy or girl, immediately, the teacher or the school people get into action and make sure that it doesn't end up with a complication.
So coming to a very important aspect of diabetes management is exercise. Does exercise plays the same role in the treatment of type 1?
Exercise is also important because one, it improves the muscle mass. Second, it improves utilization of glucose in body. So more you exercise, there is more utilization. But you cannot, advise endless exercise. So, regular exercise is certainly important because it helps in preventing weight gain. It helps in improving muscle mass. It helps in reducing insulin resistance. Now we are seeing so many children who started as type 1. After say 5 to 10 years, when they started moving towards their end of school or early college times, they got little extra money for pocket and they have all Swiggies and Zomatos delivering whatever they want to deliver. So they have gained weight. So now we are seeing type 1 children with type 2 features also, which is, so it's a dual disease now, which is coming up in children. So regular exercise prevents weight gain and delays the risk of getting type 2 features also. So it is very important to exercise regularly.
These kids are, we should say, type 1 individuals. They should have a proper diet and exercise regime throughout their life.
Diet modifications and exercise are actually, there is not exactly modification of, I would say, you move from unhealthy to a healthy eating pattern. If you are eating on time every day, there is nothing wrong in it. it is good for health. If you are consistent with your portion size, again, it is good for health. There is nothing wrong with that. If you are avoiding sugars and fats in your meals, it is again good for health. And this is what is healthy diabetic diet. The problem is that most of the people don't want to follow that. Don't follow that. They are too careless. We can manage without that. I don't eat anything. I can. Okay, I don't want to eat this time. My sugar is high, so that leads to a lot of fluctuation and actually increases the risk of hypoglycemia also.
Till date, we consider diabetes as a social stigma. Acceptance is very low, sir.
I agree.
So now coming to the medication part, what is the treatment for type 1 diabetes?
So the only medication that is available for type 1 and the only thing that works in type 1 is insulin. There are some experimental medications right now which are being studied, but we are not too sure whether you will get the same impact as you are getting with the injectable insulin. Possibly we will have a couple of molecules in next 2 years, which may show some positive effect in type 1 diabetes also, but it is too early to say. Even the bone marrow replacement and the islet cell transplantation and so on has not proven to be very good option for actually attempt to cure type 1 diabetes. So most of the things that have been tried, they are still in experimental stages. The most important thing remains, the key remains the diet, regular physical activity, eating on time, eating consistent, and using insulin. And mind you, most of the children will require 2 different insulins to be given at least one insulin to be given once and other insulin to be given at least 3 to 4 times every day before every meal. So it is not that somebody has initiated you on 4 shots of insulin and you feel that this is wrong or something else needs to be done. No. So most of the children will need 2 different insulins to be injected in 4 to 5 shots every day.
So now talking about the monitoring, how important is monitoring in these individuals, and what ways we can make the life of these kids or individuals little easy with the use of technology?
So first thing is monitoring. Unless we are testing sugar, we don't know where the sugar is going. So the only way to know whether your sugars are under control or no is regular monitoring of glucose. Second thing is, because they are using multiple injections of insulin, there can be sudden lows and sudden highs, both. To know that, you again need to check very frequently. To prevent hypoglycemia or low sugar levels, you have to keep monitoring sugar levels very frequently. So on an average, it is recommended that all type 1 children should test their sugar at least once daily in the fasting state. And out of 6 different times, which are 3 before meals and 3 1.5 to 2 hours after each meal during the day, they can opt to do 4 to 6 times every day. And this depends on how good their control is. If they are very well controlled, maybe they can do with less frequency of monitoring. But if they are not controlled, they must be testing at least 4 to 6, 7 times a day to make sure that their sugar levels are working fine, and what the action that they are expecting from use of insulin is also there. And if there is a dose change requirement or there is increased risk of hypoglycemia, all these things can be checked on again by monitoring.
So how can we use technology to give a quality life?
So we have now lots of things to manage type 1 diabetes. And first thing is that we can use, first challenge comes is the multiple doses of insulin. So one can go for pump. Unfortunate part is that in India, it is not reimbursed by insurance. It is not taken care by insurance. And government doesn't have facility to provide pump. Government doesn't have, that high expensive gadgets being available in the government centers or even the government centers of excellence, which can be given to poor patients. Now, even if you give them, to sustain those, it will be a challenge because there is a lot of cost associated with disposables also. So there are people who can buy and they can actually opt for pump. And the latest pumps are very good. They not only deliver insulin at a regulated rate, they also tell you when the child is going to go towards hypoglycemia or hyperglycemia. So basically, insulin pump is a device which continuously infuses insulin going at a steady rate under the skin, and from there it is going to
Control the blood
the
sugar levels.
circulation and the liver and controlling the glucose. Now, important thing is this rate of infusion varies depending on the need. So there are pumps where the children are trained to eat on time, eat regularly, and then what are the levels of glucose. And the pump, you can train the child or the parent to provide a particular dose algorithm that during fasting state you have to infuse say 1 unit per hour. During post-meal state, you increase this dose to 1.2 to 2 units per hour. And after the meal, after 4 hours after meal, you bring it down to, 1 unit per hour. So these are the things that can be done with pump. Now, for injection, you have to keep pricking every time. With pump, you can use a cannula which lasts there for 72 hours. But then 72 hours, you have to change it. And the cost of monitoring goes up. Cost of infusion goes up. Similarly, for monitoring, you can use, now flash monitoring systems where you put a sensor on the back of arm and it keeps recording your sugar every 15 minutes, and you just need to check the sugar with scanner. So anytime you go closer to scanner, it will show you the current sugar levels. And you don't need to prick, and this lasts for 14 days. But again, cost is a challenge. Third is continuous glucose monitors, which are there. And then, there are now integrated pumps. There is a pump device which is injecting insulin, and there is a sensor which is communicating with this pump. So sensor has picked up a sugar level of say 200. So it communicates with pump, and there is a AI based algorithm which tells it to bring it to less than 140, you will need X amount of insulin, right? And that X amount of, according to the X amount of insulin, the infusion rate is modified. Second thing is pumps can also tell you that now the child is moving towards low sugar level. So there are alerts that you can set for low and high, right? So all these things are doable when you are using technology. If there is no technology, you have to depend on 4 injections and 4 to 7 points of time testing. But still, it is good enough or decent enough to keep the children nearer to control and certainly reduces the risk of complications.
This is the best part, sir.
Yeah.
So what are the risks associated with individuals who have type 1 diabetes?
So all diabetes, because of the persistent glucose levels which are high, as I think I mentioned in one of the previous sessions also, that circulating high glucose levels, they are high sugar levels in blood. Now blood is going to every single tissue or blood cell in the body cell. Now wherever these cells get exposed to high level of sugars, they start getting damaged gradually. And there are certain tissues which are more prone to get damaged than the other tissues, right? So, just, went out of my head. So,
The sugar levels are out of control. Definitely the organs are affected, sir.
So there is a threshold of glucose above which the damage goes on. Now, studies have actually now shown that there is no threshold also. As the glucose levels start going above the level of 100, the risk of damage goes on increasing. So it is important to keep sugar levels in good control. Now, since there is a continuum, the higher the glucose levels, higher the risk of damage. The major damage occurs in the systems where there is high blood flow, or wherever the exposure to glucose is high. And most important thing is the blood vessels which carry blood. So there is damage to all the blood vessels, whether it is large or small, because of high glucose levels. And that damage leads to macrovascular or microvascular complications. The classic complications caused by diabetes or high glucose levels are kidney damage, eye damage, nerve damage, damage to heart. There can be clotting in the damaged blood vessels leading to stroke, heart attacks. There can be clotting in blood vessels supplying feet, leading to foot complications, ultimately leading to gangrenes and resulting in amputation. So virtually there is damage to all parts of body, but the classical damage that we consider is the microvascular complications, which are neuropathy, kidney damage, nephropathy, retinopathy, the damage to eye, and major macrovascular is the risk of heart attacks and strokes. So all these are increased because of diabetes. Now, important thing to keep in mind here is that these complications may not be fatal in all the patients, but they certainly lead to a very compromised quality of life. And these complications are certainly preventable with good glucose control. So if you have very good glucose control, then chances of getting these complications are low, and it takes very long time to develop these complications. So somebody with poor control may get complications in, say, next 10 years time. The other person who has very good control may not get these complications for next 40 years time. Not only it provides good control, provides good quality of life, it defers the risk of complications also. So that is also very important.
So if we talk about the complications, sir, they are more or less the same in both the type of diabetes?
Largely, yes.
And we have to have a good control. Main
Yes.
thing is that.
Yes.
So there's a question from our audience. इंसुलिन की डोज बड़ा बड़ा आकर लगाना बॉडी को इफेक्ट नहीं करता क्या? शुगर ज्यादा हो तो इंसुलिन की डोज भी बढ़ानी पड़ती है, बॉडी को कोई साइड इफेक्ट्स तो नहीं होते हैं ज्यादा टाइम तक?
अगर आपकी शुगर लेवल ज्यादा है, इफ यू हैव हाई शुगर लेवल्स, you need more insulin to control it. Damage is caused by the high sugar levels and the fluctuating sugar levels, not by the high insulin. High insulin is considered to cause certain problems when there is resistance, insulin resistance, which is in type 2. Type 1, the only way to treat type 1 is insulin, and you are giving insulin from outside because the body does not form its own insulin. The mechanism or the machine that was producing its own insulin is now damaged. Since you cannot put a new machine inside body to produce natural insulin, so you are providing insulin from outside. So if you look at the history before 1921, 1921, when the year when insulin was for insulin, the Nobel Prize was given to Banting and Best. After that, it came into commercial use. The children with type 1, they used to die within few months to couple of years. And the first child who was put on that insulin preparation, which used to very, very, very kind of say impure or turbid kind of injectable preparation. Just to give you an idea that the impurity level in the first formed insulins was something like 40,000 parts per pill. ppm is parts per million, and what you get now is less than 10. So compare with 40,000 with less than 10. and the insulin units were 10 units per ml. And now you get 100 to 300 units per ml. So imagine the size of injection also. And you were using glass syringes and boiled needles during those times. Those children who were put on insulin survived into 60s and 70s of their life. While before that, they were dying in 6 months to 1 year time. So this is the insulin is a life-saving drug for type 1 children. Type 1 children, there are no side effects of insulin. Even if they are there, even I say if they are there, they cannot be more than the benefits of insulin that are there in type 1. So there is no second thought that you have to use insulin in type 1, and you have to use it for rest of the life of child, going into old age also. And you have to give enough insulin to keep sugar in control, which will vary from one individual to other individual.
Because it's the only treatment available for these
It's the
kids.
only treatment, and you should not be, bothered how much insulin you are using. You should be bothered how good is your sugar control.
Yes. And I think it's nothing to be scared of insulin, sir.
Absolutely nothing.
Right. So, sir, my next question to you is, can we expect a normal life for a type 1 individual?
I would not say normal life, but yes, near normal life, absolutely no problem. I think a child with the diabetes is far better off than a child who will develop a arthritis or bone damage. A child with diabetes, the only difference is that child has to have a regulated meal, keep monitoring his sugar and keep using insulin. But child can go out and play with friends, child can go to school. Most of the type 1 children are intelligent children.
Yes.
This is something which is noticeable. So they do well in schools, they do well with education, they do well in sports. Some of the top athletes and cricketers have been type 1. Some of the Miss Indias and Miss Universe have been type 1.
Yes.
So there is nothing, it doesn't stop you from achieving anything in life. But suppose some children have asthma. Fortunate thing is that good number of them will stop being asthmatic after certain age of life. But as long as they are asthmatic, there are so many issues with their, studies, mobility, everything. Suppose child is having worsening of asthma, child cannot go to school, child cannot go to, and has to take inhalers, treatment, hospitalizations bhi hote hain. So there are things which compromise the quality of life. Diabetes does, because you have to inject. As of now, we don't have the, treatments to bypass injectables or monitoring, but we are getting newer technologies. Now imagine if once the cost of the pumps, integrated pumps with a sensor technology becomes cheaper, all you need to do is put a pump and a sensor, and sensor is telling the pump how much insulin is to be infused, because sensor is checking the glucose. You don't need to bother. Whatever you want to eat, you eat. Your sugar goes up, sensor will tell the pump now increase the insulin. Insulin increases there, sugar is controlled. So we are moving towards much better times. So in times to come, this will become a much less challenge as compared to so many other diseases that children have.
Actually, sir, if we talk about type 1, it's a very sensitive issue, and the whole family is into it, especially the role of mother is a lot.
I think everybody has to be, very sporting as far as the child. They should not be made to feel that they have some disease. And the most important thing is the school teacher, the class teacher must be informed that child is type 1. And these are certain precautions that you have to keep in mind. And suppose child is getting into low sugar, child must be allowed to eat whatever time, irrespective of the class time or lunch break. It doesn't kill if child is eating, sitting in the class, and it is not to be, he or she is not to be made to feel, so that they are doing something wrong or something they are something different. You know, there are times when children end up sleeping in the school. So is it a crime to sleep? So they can get hungry also. So they can eat. So I think this teacher has to be informed. Teachers have to understand that these are the issues. Parents have to understand that, okay, this is a limitation that you have to live with. But with that limitation, you can actually do everything else. So you can live near normal life.
Very true, sir. So now my last and a very important question to you is, can type 1 diabetes be reversed?
So as of now, we do not have any evidence or any studies showing reversal of type 1 diabetes. Now, there is interesting phenomena which happens in good number of type 1 children or type 1 patients, whether they are children or adults, that they become diabetic. And after certain period of high glucose levels, they move to a stage which is when the glucose levels fall to normal levels. And they stop needing insulin during that period. And this period is called honeymoon phase. What happens is, the concept is that there is an acute situation which leads to significant increase in the insulin demand in body, which cannot be provided by the failing beta cells or beta cells which are already undergoing destruction. And once you correct that situation, beta cell reserve is still that much that it provides insulin to sustain normal glucose levels. And as it declines further, the glucose levels start going up again. And some people interpret that this can be reversal, and some of these self-styled alternative medicine people also claim that we can treat diabetes, we can make you stop insulin, and there is no need to take insulin. And you can see all kind of trash videos happening that people are showing that I can show you that you drink fruit juice and the sugar will not go up. I can show you this. All this is trash. Don't get carried away, because we see people ending up with complications, severe diabetic ketoacidosis, hospitalizations, because they are trying to kind of get rid of insulin. If insulin is required, it is required. It must be given. There is no alternative. Yes, there may be a honeymoon phase, which is not reversal of diabetes. So that you have to keep in mind.
So can I take a question, but not related to type 1, it's related to type 2?
Yeah, why not?
Hereditary predisposition is more in males or females? How long pre-diabetes goes on in such cases, and how long it takes to impair kidney function, neuropathy, neuro or retinopathy?
So there are multiple questions in this question. First,
yes, it's a big one.
The in type 2 diabetes, doesn't matter whether your first male parent is diabetic or female parent is diabetes. Chances of getting diabetes are hard. I think there is slightly increased predisposition in men as compared to women, but does not actually make much difference. Second thing is the pre-diabetes. So pre-diabetes is a stage which will come, which is just stage before the frank diabetes. You are in the gray zone. Now, important thing is, whatever genetic predisposition you have, it changes with the environmental factors also. So if you are living in a very healthy environment, having healthy food, pursuing regular physical activity, maintaining normal body weight, you may stay in pre-diabetic state for many years, or may reverse from pre-diabetes to normal also. But if you have a bad lifestyle, you are overweight, obese, you are consistently, sitting and eating, or, you are low on physical activity, you have high stress life, all these can predispose you to get pre-diabetes also earlier, and conversion from pre-diabetes to diabetes also can happen earlier. So it varies from person to person. So most crux of the story is that even if you have bad genes, you can reduce the impact of those bad genes by having a good, healthy lifestyle. If you have very good genes, you can still lose that advantage of good genes by having a bad lifestyle. So having a good, healthy lifestyle is very important, both for prevention of diabetes, for prevention of complications, and having a good quality of life.
Thank you, sir. So that leads to the end of the session. Thank you everyone for joining and
Thank
hope
you,
it
Dr.
was,
Kirti. Thank you, everyone.
sir, I hope it was a knowledge imparting session to the audience
Let's
and
hope
they have
so.
a lot of myths cleared through this session.
We are trying to do that. Let's hope we are, achieving whatever bit we are trying. To some extent, we are achieving our goals. And the way we are getting feedback, I think people are liking these sessions. They feel benefited. That's the purpose of these sessions.
Sir, only
Thank you,
request-
everyone.
Right, sir. Thank you.
Yeah,
Thank
you wanted to say something.
Yeah, sir. My only request to everybody is that type 1 diabetes has no cure except insulin is the management tool. So please don't be scared of insulin.
Absolutely. I made it very clear there is no
Yes.
option for type 2, type
Yes.
1 diabetes. Don't get carried away with anything and
Yes.
everything. All the promises are going to end up on the wrong side.
Sir, I felt very bad today. On Facebook, I had a poster coming across that type 1 is reversible. So
No,
I
it is not.
particularly took this question from you.
So I told you that you
Yes.
can see videos, they are
Yes.
showing you that you can take fruit juice, nothing happens. These are all trash.
Right, sir. Thank you, everyone. Thank you, sir.
Thank you.